Another Thursday and another opportunity for us to discuss on health-related issues and how we can better tackle them. I am your host, Immaculate Fogwe. Good afternoon and thank you so much for joining us. Today we'll be looking at glaucoma. Glaucoma can strike silently, damaging your optic nerve without warning. But now the question is, how can we prevent ourselves from being victims of glaucoma? That's what we are going to be looking at in the course of this program, but that's after this short break. Stay with us. Thank you so much for staying with Equinoxe Radio Multimedia, and I'll be having as guest Dr. ABERA CHANE. He is an ophthalmologist at the Acha Hospital right here in the city of Douala. Good day. It's a pleasure to have you on the program today.
Thank you.
Doctor, today we'll be looking at glaucoma. It has been described as a silent killer, or a silent situation that can affect people's vision, and it seems to be very common in our society today. Tell us, first of all, what's glaucoma all about and how can it affect someone's vision?
Okay, thank you very much. First of all, I would like to thank you for inviting me. I am Dr. ABERA CHANE, an ophthalmologist, currently working at Acha Hospital, Douala. And I'm very happy today to be here to discuss on one of the leading causes of irreversible blindness, which is glaucoma. So to begin with, what is glaucoma? Glaucoma is a group of eye diseases that damage the optic nerve, which is a nerve that connects the eye with the brain. And usually it is associated with high pressure inside the eye, but the high pressure only doesn't cause glaucoma, so it is an association. So glaucoma is mainly affecting or damaging the optic nerve. That is the nerve most important that can enable us to see. So this is glaucoma, and not only a high pressure inside the eye is the cause for glaucoma, but also there are glaucoma with a normal eye pressure, and we call them this normal tension glaucoma. And then sometimes despite high pressure inside the eye, but a patient or individual may not have glaucoma also, so we call them ocular hypertension. But let me bring to you the global burden of glaucoma in our continent Africa, and particularly in our country Cameroon. So glaucoma is the leading cause of irreversible blindness worldwide. Around 80 million people are affected currently in the world, and around 1.6 million in Cameroon. And this glaucoma is affecting majority of the low socioeconomic status, who are living in low socioeconomic status, like Africa and Asia. And in Africa, particularly in sub-Saharan Africa, is more prominent. So but the good news is that even though once vision, permanent vision occurred, we cannot reverse glaucoma. It has a promising things that glaucoma can be controlled if we can detect early and control and start treatment. We can prevent blindness from glaucoma.
Okay, now before coming to that prevention, tell us who is at risk of suffering with glaucoma. Okay,
it's a nice question. Anyone can get glaucoma, but there are risk factors who are more vulnerable for glaucoma development than the others. These are when a person is above the age of 14, it means old age.
That's from 14 years old?
Yes.
So a baby can suffer with glaucoma?
No, a baby even can develop glaucoma.
Okay.
I mean the risk.
Okay.
I say on my beginning, anyone.
Okay.
From a baby to
An adult. Okay.
They can get glaucoma. But there are risks who are at risk. The risk factors are: one is age above 14 years.
Okay.
And as we age, risk of acquiring glaucoma is high. And the second one is family history. If we have a glaucoma patient in our family, especially our parents and our siblings, we are at risk for development of glaucoma. So it is better to go and screen for glaucoma. And the third one is being an African descent. Being an African descent is also a risk factor. So because of different reasons, speculations. One is genetic predisposition. The second one we have a baseline high eye pressure. And the third one is our nerve is susceptible for pressure rises. Okay, because of these reasons, also being black or being an African is also a risk. And the other risk factor is that high pressure inside the eye. This is the most and significant risk factor, and that all the glaucoma treatments are targeting this modifier risk factor. Okay, so high pressure inside the eye is a risk factor for development of glaucoma. And the other risk factor is that when we have other medical conditions like diabetic, hypertension, these are risk factor. And from eye diseases like high myopia, high hyperopia, or refractive errors. Okay, these are also risk factors. The other risk factors are long-term use of steroids.
Steroids. What are steroids, please?
Yes, steroids are anti-inflammatory drugs for inflammation.
Okay.
Whether they are taking in the eye drops, whether it's in tablet form or in the injection, they are a risk factor for development of glaucoma, especially if we take them for a longer period of time.
Okay.
And the other one is if we have had an injury in the past to the eye, injury or a trauma to the eye is also a risk factor for development of glaucoma. Thank you.
Now, how does glaucoma differ from other eye complications? Let's say, for example, cataract. You earlier mentioned, talked about high pressure on the eyes, and equally some people even having low pressure but still suffering with glaucoma. How does it differ from other eye complications?
Okay, thank you. It's a good question. Glaucoma is different from the other diseases in that it has a peculiar features. Since the beginning, it is a silent. It doesn't have a symptom in the early stages. Even it doesn't affect the vision of the patient. So no vision, no pain, and no other symptom in the early phase. As a result, and it is also called a silent thief of sight. Okay. Because of these characteristics. And when compared to cataract, patients who have a cataract usually they have a vision disturbance, they have blurry vision or cloudy vision, so that they will seek a medical advice, and they go to health facilities for their checkup. But because of asymptomatic nature of glaucoma, people will not go to the health facilities early, and then they will come and the bad thing of glaucoma is that their symptoms are coming late. So when they come late, and the prognosis is poor.
Okay.
Yes, and okay, let me finish.
Go ahead.
Okay, when you say cataract is just a disease of a lens, and even the part of the eye are different who are affected by glaucoma and the cataract. Glaucoma is affecting the nerve that is connecting the eye to the brain, and you can take it as if it is a cable connecting the eye to the brain, so that information will transfer from the eye to the brain, so it will damage the wires in the cable. Glaucoma, while cataract is the lens. And to make it in a simple English, cataracts is like fogging or dirty in the window of a mirror, while cataract is injury of a wire or a cable. And the management wise is different. The most important difference is that cataract, patient may get blind due to cataract, but we can do surgery and restore their vision.
Okay.
Yes, but when we come to glaucoma, once it's get blind, we cannot reverse.
Okay.
Even with surgery, we cannot reverse it. So the most important thing is that glaucoma should be detected early, screened, detected, and then treat early, and we can control and prevent blindness from glaucoma.
Okay.
Yes, thank you.
For those who would like to participate in today's edition of the program to ask your questions about glaucoma, here are the contacts to call: 670 54 70 49. I repeat, 670 54 70 49, or 656 622222, 656 622222. Those are the numbers you can call and ask your questions as far as glaucoma is concerned. Back to you, doctor. You talked about early detection. How often should we get ourselves screened for glaucoma?
Yes. If we don't have a risk factor for glaucoma, as I mentioned before, if we are not above the age of 40, we don't have family history, we are not African descent, we are not using long-term steroids or history of...
I think we'll have a call on the line. We'll come back to that question.
Okay.
Oh, we lost that caller. You can continue.
So if you don't have the above risk factors, we can, and we are below the age of 40.
I think we have another caller.
Okay.
I think we have some connection problems, but we'll try insist so you can ask your questions as far as glaucoma is concerned.
Okay. So it takes...
Seems the caller is on. Hello?
Hello?
Please, can you turn off your TV or radio sets, please? We can get the background sound. Bonjour. Est-ce que vous pouvez éteindre votre télévision ou bien radio, s'il vous plaît?
Good morning. Bonjour.
Good morning, sir. Please turn off your TV or radio set before asking your question. Please, before you want to call for the program, turn off your radio or TV sets because it's going to affect communication. Thank you so much. Back to you, doctor. We were talking about how often should we get ourselves screened as far as glaucoma is concerned.
Okay. So if you don't have any risk factors, the recommended screening is 2 to 3 years.
2 to 3 years.
Yes.
For those who don't have risk factors.
Yes.
Okay.
Those who have risk factors, it's recommended to have every year. Every 1 year.
Okay, we have a call on the line. Let's get this caller. Hello? Unfortunately, we can't have that caller due to connection issues. Now, back to you, doctor. Are there any common myths about glaucoma you would like to debunk in the course of this program?
Yes, it's true. Among them, let me explain a few of them. One is glaucoma is caused by spiritual forces or witchcraft.
Witches are wizards.
Yes. So this is the truth is it's not. So it's a medical condition.
Yeah.
And then it is a medical condition, and it's not associated with any spiritual things. Witchcraft. Okay. Yeah. So it's a medical condition and it can be treatable and controlled. Yes. And the second one is people, they ask after they get blind due to glaucoma, surgery, they thought as a cataract so that their vision be stored after surgery. And this is not. After getting blind due to glaucoma, even surgery cannot restore the vision again. Okay.
So it's definite.
Yes. So before that, the thing is that the most important thing is that to control glaucoma.
We have another call on the line. Yes, hello. We hope it's going to be better. Hello, sir. Good afternoon.
Good afternoon, madam.
Your name, where you're calling from, and your question. It's Equinoxe. Of course, sir. Go ahead.
Yes, my name is Ambe Dennis. I'm calling from Yaoundé.
Okay, sir. Go ahead with your question.
Yes. I have a problem. I have a glaucoma, and the question is, when one has glaucoma, does he have to be taking medication throughout his life? Is there no time when it will get finished?
Okay, sir. Thank you so much for participating in the program. You got the question, doctor?
Yes.
Okay, go ahead to answer.
Okay, we'll come in later, but okay, because our audience is asking for this one. Glaucoma is a lifelong treatment.
Okay.
But it doesn't mean we'll take
medications all through your life.
All through your life. It depends. For example, we start with a single medications in the beginning, and then we follow and we see, and then whether the glaucoma is controlled or not, we assess. We may add additional eye drop, or we may change the medication if the pressure or the target pressure is not met. And the second thing is that if despite all these medications, if we cannot control the pressure, we can further use a laser treatment.
I think we have another call on the line. We'll come back to that question too. Hello?
Oui, bonjour madame.
Bonjour monsieur.
Oui.
Votre nom, là où vous appelez vos questions, votre question monsieur.
Je suis à Bonabéry. Moi c'est Philippe Emeni.
D'accord monsieur, allez-y.
Oui, j'ai le
D'accord. C'est quoi votre préoccupation?
Oui, on m'avait demandé, on m'avait dit qu'on ne peut pas opérer.
D'accord.
Et je vois plus.
Vous ne voyez plus complètement?
Non, je vois mais plus.
D'accord. Et vous voulez maintenant savoir?
Oui, je veux que le docteur m'explique comment je peux faire.
D'accord. Merci d'avoir participé à cette émission. You got a question? He says he has glaucoma for a while now, and his vision is kind of blur. He's asking what an advice you can give him so he can better his condition. But I think first of all, continue with the first question before coming to him.
Okay, you remind me later.
Yeah.
Okay.
So come back to the first question.
Okay, so there are mainly three treatment modalities or options. One is treating glaucoma with medication, and if not, we go to laser treatment, and the third one and the final one is surgery.
Okay.
So based on the stage of the glaucoma, we can suggest eye drops, laser, or surgery.
But it's not lifelong, as you earlier said.
It could be a lifelong.
Okay, it could
be.
As
far as the medications are controlling the pressure, and then the glaucoma is not progressing, it can be lifelong. Yes.
Okay, now, but are you done with that first question?
Yes. If not controlled, we can shift to laser, and you can also do surgery.
Okay, second question now. He has glaucoma. It has affected his vision for a while. What should he do?
Okay, I want to ask more questions.
We are still waiting on callers, but you can answer the question. You want us to go back to something else? He's asking. He has glaucoma for a while. His vision has been affected. He's asking from an expert like you. What should he do?
Yes. Okay, the vision is reduced. Maybe because of poor pressure control. It could be because I cannot.
He has to come to the hospital. Exactly.
The first thing is that he has to come to the health institution, and then check. He has to check his pressure. He has to check other eye parts. Okay. There are a lot of things, not only glaucoma. There could be associated things which can make the eye blurred.
Okay.
So if the others are fine and only glaucoma, it may be the pressure is not controlled. When the pressure gets high, it causes blurry vision, and sometimes also it causes pain. But the thing is that I don't know whether our audience.
Reason why he has to come and consult from people like you to have expert view on what's happening with him.
Yes, maybe if he has also diabetic or hypertension, it's better also to control the systemic illnesses.
Okay.
Sometimes when the sugar is high, he may have also blurry vision.
Okay.
Yes.
Now tell us more about activities that will be taking place at your hospital. That is the Acha Eye Hospital. We have Glaucoma Week that begins from the 8th to the 14th of this month's March.
Yes.
Tell us more about it.
Okay, thank you. Okay, next week is World Glaucoma Week, which is celebrated throughout the world, and part of it, our Acha Eye Hospital is prepared and to celebrate and to serve for the community. And already it was started 2 weeks back, already sensitization of glaucoma for the Douala community and the surrounding. And then we are also giving health education and health talks on glaucoma daily in our hospital. And on the coming Sunday also we have awareness creation on the churches. In the church, and then we are prepared on the 12 and 13. 12 and 13 for 2 days. We are organizing a special campaign in supporting of this glaucoma awareness week, and we are offering a free screening. For a free screening for 2 days. And then
that's which date again? Free screening
12 and 13.
12 and 13th of March. Free screening at the Acha High Hospital.
Douala, yes. And then we give also free reading glasses.
Wow.
Yes, and we give we also make a discount, 10% discount from prescribed eyeglasses.
Wow.
Yes, and also we give with an affordable price all the other comprehensive eye exams, an affordable price, and even surgeries or operations also are affordable by that week. And
go ahead.
And so I want to invite all people, especially above the age of 14, to come and to use this opportunity for a free screening, so that glaucoma is silent, it doesn't have a symptom. So please come and get screened and use this opportunity. Thank you very much.
What about someone who just got diagnosed with glaucoma and the person is overwhelmed? What advice do you have for that person at this moment?
Yes, my advice is that glaucoma, yes, it is a chronic disease. It's a long-term treatment. Some embarrassing, but the thing is that if they take the medication properly, if they have a regular follow-up, and if they don't miss any appointments, and then if they have a good communication with eye doctors, glaucoma is we can prevent blindness from glaucoma, so that is no worry. Glaucoma is preventable blindness. So they should not worry, rather they should ready themselves, so that for the long journey to live with glaucoma. As that of there are a lot of not only eye disease but also systemic illnesses like diabetes, hypertension, yes, even HIV/AIDS. People are living, yes, for a long time. They are taking insulin for diabetic patients. It's the same like that. So that if you are get ready and prepared, even it's better than the others.
And early diagnosis is very important.
Very important. And then early diagnosis and treatment is very important. So, and then not only diagnosis and treatment, they should be adherent to their medication. They should take their medication properly. They should not miss. And then the other one is if they do dietary, lifestyle modification, they should reduce their weight. They should avoid excessive alcohol drinking, stop smoking. Other things, the other risk factors, they will. It will be fine.
Thank you so much, Dr. ABERA CHANE, an ophthalmologist at the Acha Eye Hospital right here in the city of Douala. And thank you, ladies and gentlemen, for staying with us. I was your host, Immaculate Fogwe, and I received technical assistance from Louis Pego and Jonathan Babula. From us in the studio right here to you over there, have a wonderful day. Bye-bye for now.